The following segment is sponsored by NextGenRx. There's a lot of interest in natural therapies, but it can be really confusing to find out if they're right for you or what they're all about. So the experts at NextGenRx can help with that. We have Chad Edwards from Revolution Health and DJ Lees from NextGenRx. How are you?
Great, thanks.
Great. Okay, well, let's start off with how you all two work together. You're at a doctor's office and you're at a pharmacy, but you all kind of work together. Explain that.
So both of us are doctors. He's a DO, a doctor of osteopathic medicine. I'm a doctor of pharmacy. At NextGenRx, we're a compounding pharmacy. We work hand in hand with our physicians to make sure that what we do is congruent with his patient's needs. So everything that we do, we make sure to communicate that effectively for our patients to the doctor, and make sure that and likewise, we have the doctor communicate back to us if there's some things that we need to change to make sure that it's specifically meeting the needs of the patients.
And Dr. Edwards, you really have several unique therapies, including prolotherapy. Am I saying that right?
You got it.
A lot of people probably haven't even heard about it. Tell us.
So prolotherapy is a minimally invasive procedure that can help a lot of patients that have musculoskeletal pain. So you think about the patient that was in a car accident, or athletes that have chronic knee pain, elbow pain, back pain, neck pain, and we can help a lot with those patients, and in many cases resolve their pain. So it's a cool procedure that's been around for a long time.
Why haven't people heard about it? I mean, so many people suffer with especially back pain.
Right. The research behind prolotherapy is mixed, and there's not a lot of money to be made by pharmaceutical industries and things like that to fund large studies, but on an individual scale, we know this procedure works, and it works very, very well. A greater than 85% success rate with this procedure.
And there's not a huge risk involved, so it'd be worth trying.
Absolutely.
Yeah.
I recommend it as a first-line therapy after, giving a few weeks to let your body heal naturally. If it's not doing that, give prolotherapy a try. I've been doing the procedure for 9 years. I've never seen a single complication from the procedure.
And you also do hormone replacement therapy?
That's right. And I work with DJ a lot with hormone replacement therapy. We do pellets, we do hormone creams, we do injections, we do several different modalities. And when patients choose hormone replacement creams, we use bioidentical, meaning the same structure of the same structure of hormone that your body naturally produces. And DJ can make that in a customized ratio for the patient so that they get the best outcome and they feel the best that they can feel.
And they can go to you and say, hey, this isn't working out the way that I wanted it to.
So what we do at our pharmacy is we make sure that we're an open book between the physician and the patient. So if there's some things, like I had a patient the other day who didn't respond well to oral therapy with her progesterone, and she said, I really want to try to take this topically. So I get on the phone and call up doc and say, hey doc, patient so-and-so is having some adverse effects of taking this progesterone orally, and she would like to try it topically. Is that something that is okay with you? And then I get the approval, and we call the patient back and say, we've got your prescription ready, and we're going to use this topically to treat those symptoms that we're having. I
really like that you encourage patients to maximize a pharmacist's knowledge, because I mean, they're not just filling up medications back in the back. You all have to have extensive schooling and know a lot about these medications.
We do. We put a lot of pride into what we do, and we make sure that we go the extra mile to make sure our patients are taken care of.
Okay, now IV nutritional therapy. I love this because I said, is that like one of those B12 shots? And you said sort of, but like a super boost.
Right. So with IV nutritional therapy, we find so many patients have problems with their gut health, and like gluten intolerance, and they just don't have healthy guts. And when their gut is not optimally healthy, they don't absorb their nutrients well. And then of course you look at the standard American diet, which is atrocious for optimizing health and nutrition. And so with IV nutritional therapies, we can get much higher doses of these micronutrients to optimize human performance, health, immune function, all kinds of things, and we get great results with a lot of different conditions with our IV nutritional therapies.
Improving your gut. It seems like to be like a kind of trending topic these days in the health world too. Also medical spa, right?
That's right.
Yeah, so all the Botox and fix my face.
Right, so we do all of your injectables, your Kybellas and Juvederm and Botox, all of those kinds of things. We have an esthetician full-time on staff, so you get your facials and all your feel-good kind of stuff.
Yeah.
So you need your mommy's day out, something like that. It's a great option. One of my staff came and said, I don't know what she did, but it was the best hour of my life.
There you go.
Amazing stuff.
I love it. Next Gen RX, that's the pharmacy, 811 West New Orleans, Broken Arrow 918-578-0031. mynextgenrx.com, and they're also on Facebook. Revolution Health and Wellness is 12142 South Yukon in Glenpool, 918-935-3636, revolutionhealth.org, also on Facebook.